Thank you all so much for joining us this week. Julie, I want to start with you. Can you tell us about your family and what Medicaid services you use?
Yeah, I'm a mom of 6. My 2 youngest boys are 10-year-old twins, and they both have a diagnosis of Down syndrome. We utilize Medicaid for a myriad of services, from everything medical with multiple specialists, dental, vision, but also we use the FDS waiver, the Family Directed Services waiver, where they're able to access other types of therapies. We have folks that we can hire, community support workers, to help them. We have interventionists. Of course, they receive special education services that are funded by Medicaid. They receive different types of therapy, speech, OT, PT, those sort of things. So it's a whole host of things that support them.
How are you worried that these services might be affected if some of these proposed cuts go into effect?
Well, I'm concerned about all of them. I mean, the therapies have been absolutely instrumental in their lives since they were babies, teaching them the most foundational skills, from eating, walking, crawling, speaking, holding a pencil correctly, everything. And they continue to be of great value for them as they continue to grow and develop. They're kind of on a little more scenic route, so some of those things are taking a little longer and they need that continued support. So losing those would be devastating for sure. And then those home and community-based services are the things that we're kind of able to customize to their needs. Those are the things that allow them to learn skills that they need to be in their community, safety skills, basic living skills, those types of things. Help them develop just more skills, like they have some alternative therapies that have taught them some bravery, just some being more adventurous, taught them how to swim, those type of things. So they're really valuable, and to see them threatened would be, again, would just be really devastating. It's services that have brought them to the place that they are now, and will continue to support them.
Ned, you're also a caretaker for your daughter. Can you tell me about your family?
Well, at this point, I'm not a direct caretaker. My wife and I live in Boise, and our daughter lives in a supported living home 4 miles away, and she receives community-based services for ResHab, which includes direct care. So we have a direct care agency, His Way, which provides staff that come to the house. She requires 24-hour-a-day care. Eva had a brain bleed near the time of birth, and so her disability of cerebral palsy is quite serious. So she requires 24-hour-a-day care, and she cannot get through the day at all without direct care helping her to do that. So I'm concerned because Eva has been in this supported living arena, being cared for the past 18 years. And it's home for her. It's a model that works. She's safe. People know her and know how to care for her. There is no way that her mother and father, who are now in their late 70s, can care for her directly at home. We cared for her for 21 years at home. At this point, she's happy, she's safe, and she has a quality of life that is unbelievably good at this point. If these cuts go through to reduce the rates for services to the agency, reimbursement rates, excuse me, if those are cut any further, they were cut earlier in this year. It is having an effect on the agency. Many of the staff have to work 90 to 100 hours a week to keep up the dedicated staff. Staffing is very scarce at this point. So if there are any further cuts, we'll start to see administrative cuts, program cuts, and then the agency model itself would be on the ropes. It would be on life support. And without that kind of care, my daughter cannot survive. From day to day, cannot survive. So it's extreme in her case. She needs the services. It's being provided well, but to further make cuts would compromise the whole model, and the whole cards of house would be, might come tumbling down.
Kristen, you receive services through the Developmental Disability Program. Can you describe what those services are and what you're worried about?
I am on Medicaid's home and community-based services. I choose to self-direct my services under the My Voice, My Choice option. Each year, I get an individualized budget I use to recruit, hire, and manage a certain number of community support workers who provide round-the-clock support to me in my own apartment. The support my staff provide includes helping me get in and out of bed, shower, use the restroom, get dressed, prepare my meals, drive me to appointments, help me get my groceries, and most importantly, they help me take my medications every day. My staff do all these things at a fraction of the cost it would be for me to receive these same services in a nursing home. I am worried that if home and community-based services are cut, I will be homeless because I refuse to go to a nursing home or an institution. I'd rather die. I don't have family that I can live with.
And I know that there's been a lot of concern in the legislature and around the country about fraud, but there are layers of oversight that you go through every year to get your budget to spend on these services. What are those layers of oversight?
For me to be eligible for these services, they must cost less than living in a nursing home to save the state money. This means I get an annual budget determined through a state assessment process. Every year, I create a plan with the budget I am given that must be approved through the Division of Medicaid. While I am considered nursing home level of care and could live in a nursing home based on my needs, I will never make this choice because I refuse to live in an institution. I want a life, and that is not possible in a nursing home. People go there to die.
It's certainly more of a conversation than just costs at that point, absolutely. Dana, I want to bring you into the conversation. Can you describe the Medicaid services that you use and what your concerns are?
Thank you. I'm on the aged and disabled waiver. I have been since I was 18 due to a car accident. I grew up in a really small community. I grew up in a farming community. My family are farmers, or were farmers. And I was in a car accident, and I moved to Boise to go to rehab at the Elks back then. That was back in 1979. So I use Medicaid. I have two other insurances that will not cover home and community-based services. I have people, I also self-direct. We do not get a budget on the A&D waiver. It's a totally different RAND program, but I do have people that come into my home twice a day. They help me get up, help me go to the bathroom. I have a job, I've always worked, and I volunteer. Without those services, I would not be independent. Medicaid is like, it's my independence, right? It helps me be free, be able to contribute to the community. I do a lot of volunteer work. I work with the Idaho Access Project and some other different organizations where we go out and help businesses, government entities, people with disabilities, understand how to make our communities accessible. And by doing that, we bring in economic development because people with disabilities contribute to society. With the cuts, I'm very, very concerned. The people that help me only get paid for $14 an hour. They have no benefits, no vacation, really nothing. They do it because they care about me. And the beauty of being on a self-directed program is I could hire who I want. And like Kristen, I would never go to a nursing home. I'd rather die.
Ned touched on this before, but there have already been 4% cuts to the provider rates for Medicaid providers. Have you seen an impact since those 4% cuts went into effect in September?
Well, we were going to the Living Independence Network is a center for independent living, and that's where I get my services through. we were going to give, I'm on the board of directors, so I know, kind of the ins and outs with that. But we were going to give the personal assistants raises. We can't do that. You can go to McDonald's or somewhere else and you can make more money working as a care provider.
Ned, you touched on this earlier too, that you and your wife are older. Your daughter is an adult who needs people to help her as she takes care of herself. What are some of those unique challenges that aging caregivers face as they're trying to take care of their adult children?
Well, as they age, in our case, when he was small, you could carry her around and do all these things and care for her for 21 years. My wife has had 3 hip replacements, 1 failed. I've had a stroke. So we're aging. We cannot care for Eva with this level of care that she needs. It's impossible. She needs, and she can't. She needs to have someone who can understand her because she's nonverbal, but yet she has a full understanding, and she can communicate her needs in other ways. But as an aging parent, we've done what we could do. The model of care that has come along has been miraculous for us. It saved our lives and provided Eva with a quality of life that's important. So we put our eggs in this basket, and it's been performing well. It's cost effective, but without that, she cannot survive. So what can a parent do at this point? We don't have enough funds to provide 24-hour-a-day staff for our daughter for the rest of her life. She's likely to outlive us for sure. She's healthy, but what else can we do? She could become homeless at some point if things completely fell apart, but she cannot care for herself. She requires this level of care. And the providers, again, they're working oftentimes 90 to 100 hours a week. They're human beings. They're exhausted. This compromises the ability of them to actually care for her. So they were going to have raises given this year. They were given raises from the budget year starting in 2025. And yet, when the cuts came in September, that effect, because now all those extra hours are time and a half, the budget goes up, and they're planned. The agency does not want to cut wages for direct care providers. So the foundation of the organization is being trimmed.
Julie, as you listen to this, your boys are still young, they're 10 years old. What are your concerns about their future?
So it's everything that Ned has said, that, I'm going to age as well, and there'll probably come a day when I'm going to need care, so I won't be available to provide care for them. And I want a good life, a good future for my boys. I want them to live. I don't want them to just exist. I want them to live a life where they're integrated in their community, they have relationships, they have opportunities, they can go to school if they want to go to school, they can hold a job, and just have very meaningful life and give back in the same way that Dana was saying. And so that there needs to be a scaffolding around them that gives them that support so that they can continue to do that. And right now it's pretty much my full-time job to maintain that with the services that we have now. And if I'm not able to do that, of course I'm concerned about who will fill that role, who will love them the way that I do and provide it for them with the same heart that I do. And now even more so, I'm just concerned about that support system even existing. We already experience that labor shortage that Ned was talking about, the ability to find caregivers that are willing to work for you for the low wages that you have and the lack of benefits. There's no health insurance, there's no 401k, there's nothing. And you, with caregiving, it's not a job that just anyone can fill. It's very relationship based, and you want someone that you can trust, someone that cares for your child, no matter what their age, and someone that you can count on to be there for the long haul, because a lot of turnover that's not healthy, especially when they're providing such personal care.
Kristen, I know that one of your caregivers has been with you for 20 years, and both you and Dana mentioned that you don't want to go into a nursing home. That's not an option for you. Absolutely not. Some lawmakers have brought up the possibility of community volunteers or churches stepping in to fill this role. Dana, is that a viable alternative?
What do you think? Actually, no, it's not. You know, it's a great concept. You know, since I've been hurt, I have heard this concept so many times from legislators over the years. But when it comes down to it, let's be real. So on the Age and Disabled waiver, there's over 25,000 people on the waiver, right? And I have three people who help me. And okay, so we take 3. So then you need, and that's per week. So how many people would it take for volunteers? And how many volunteers are going to come in that are consistent, that know your personal care needs? Because it's not just like coming in and, you know, hey, get dressed. They actually have to physically help me get dressed, physically help me go to the bathroom. If they don't come in, I don't get up, I don't eat, I don't go to the bathroom, and then I don't go to work, I don't volunteer, I don't have a life. So I don't know any volunteer. Most volunteers don't want a volunteer job consistently. I volunteer, and honestly, I couldn't do this job consistently. Could anybody? I mean, and what happened during COVID? We were looking for volunteers because we couldn't get caretakers to come in. You know, just to back up. You know, I've seen Kristen put advertisements up, and she can't get people. You know, I can't get people. And our care is higher needs than some people. So volunteers, you know, it's a great concept, but it's totally unrealistic.
Is there anything you want lawmakers to know?
I really wish that before they start cutting programs, they would sit down and talk to us and look at what we can do to fix the programs and not totally cut the programs. I mean, it's pretty simple. I have worked on so many committees over the years, and we had great input, and lawmakers listened to us. Now it seems like they don't care, and it's really hard.
Thank you so much to our guests for joining us for a response from the Joint Budget Committee. Watch the February 12th episode of Idaho Reports.